So my name is Robert Gaspar. I am from the Hungarian University of Szeged. Our university is not as old as Charles University, but it's really old because we have roots back to the 16th, 17th centuries. Basically, I am pharmacologist. I'm graduated as a pharmacist, and this is a historical event because I am the first Hungarian who was invited to such a meeting, so special thanks to the organizing committee. But maybe it's not true because Marek was the first Hungarian, because we learned that he has a grandmother. He's still alive, 98 years old, and she is Hungarian. She was born in Hungary, so Marek was the first Hungarian. And this is another important thing, that my grandparents and grandparents spoken Slovakian language better than Hungarian. So we are very close relationship here. Today I would like to speak generally about pharmacology, the connection between pharmacology and healing, a little bit in a religious approach. And the first big religious question, how to heal, how to find the way of healing. And if we give a biblical answer, and this is true, and we heard it at the morning sessions, that God is the healer, it's no debate. But the next question, how does God heal us? And if we are very, very good religious persons, maybe we have an extreme opinion that God only heals via miracles or prayer or lifestyle modification, perhaps medical herbs, maximum medical herbs, but no human medicine. There are many religious people who refuse the medicines which are made by humans. And there is a religious scientific answer, like Marek and me, but maybe it's not not our answers, but this is another extreme answers, that maybe God today do not do any miracles, but we have to take only medicine and we have to change our lifestyle. And of course, when there is no cure, everybody can try everything what is possible, go for the alternative methods, which is also can be dangerous. The real answer from the Bible, I just want to show you 4 Bible verses which suggest something about how God heals us. First, in the 2nd Chronicles, we can read in the chapter 16 a very interesting story about a king. His name was Asa, and he was a quite good king. So he did a reformation in Judah, and he did lots of good things, but close to the end of his life, he made an association with pagans, and somehow he turned away from God. And the Bible says that in the 39th year of his reign, Asa was afflicted with a disease in his feet. Though his disease was severe, even in his illness, he did not seek help from the Lord, but only from the physicians. Then in the 44th year of his reign, Asa died and rested with his ancestors. The Bible says that there was a king, he got a disease. This disease was maintained 2 years, but he didn't want to ask Lord to help him, just the physicians. To be honest, those physicians maybe was not physicians like Marek, because maybe those physicians was mainly magicians. But this king was trusting only in the human healers, not in God. The second verse, which could be interesting for us, is from Jeremiah, chapter 46, which says that go up to Gilead and get balm, virgin daughter Egypt, but you try many medicines in vain. There is no healing for you. So these verse suggests that they were medications even in the Old Testament times, and people went for these medications and they used these medicines, but God says that there are some diseases in which the human medicine is not enough. It's not working, it's not effective, because maybe there are some spiritual disease which cannot be healed by the human medication. The third verse is very interesting, and it was cited by Peter Lundles at morning time from Ezekiel, in which we can read that the God says that you have not. No, the next verse was no. I don't know. No, this is not. I will have a Bible verse which was cited by Peter Lundles, but this is not. So this verse says in Ezekiel chapter 34 that you have no strengthened the weak or healed the sick or bound up the injured. You have not brought back the strays or searched for the lost. You have ruled them harshly and brutally. In this Bible verse, God says that we have responsibility to heal. We have to heal the weakened. We have to heal and care about the sick or even bond up the injured. This is our responsibility. And God reproved his nation that they didn't do it, but it would be necessary. And finally, from the book of Moses, third book of Moses, from the Leviticus, we have a well-known part, and these type of commandments can be found frequently in the Bible. It says, this section says that if the shiny spot on the skin is white but does not appear to be more than skin deep, and the hair in it has not turned white, the priest is to isolate the affected person for 7 days. And this is a very important text because it says that God commands to isolate the person who is suspected to be some infectious diseases. God didn't say to pray. God didn't order to organize a worship or some summit, what to do, but said act. This is the time for action. If you see such a disease, isolate. And isolation is still one of the main methods to stop the infectious diseases, if it is possible. So the Bible says that God is the healer, but God very frequently asks us to act as human, do something what we know. So the answer for the big question is God heals all the diseases, but God also urges us to use all the knowledge what we have to cope against the diseases. And that's why important the verse from Proverbs, which says that for the Lord give wisdom, for his mouth come knowledge and understanding. And we will approach pharmacology in this approach because I do believe that all the knowledge what we have about the medicines, about the pathophysiology of cancers, about all the backgrounds of the diseases came and will come from God. Even the people who are searching for it, who are investigating it, maybe they are not believing in God, but the knowledge is given by God, and they can share it and we can use it. So, if we accept that sometimes we have to use some medicines, the next question is what kind of medicines we have to use. There is another huge controversy. Should I take an industrial medicine or should I use some natural product? The general view, of course, the natural is safe and everything which is made in an industry is not safe, is unsafe. But it is not true. So those things which are natural, it doesn't mean that these things are safe. I'll tell you some examples. I don't know who would agree that the nicotine is safe. Is there anybody who agree with this opinion? No. Is nicotine a natural compound? Yes, it is in the tobacco. It is one of the most natural compounds, but it's not safe and not healthy. We can talk about cocaine. It's also a natural compound, or even caffeine, which is a very interesting topic for the Adventists, because Seventh-day Adventist always says that don't drink coffee, and we don't drink coffee, but basically we do it. So it's a very interesting bias between us. So maybe Adventists do not smoke, do not use cocaine, but lots of Adventists drink caffeinated drinks. But we obviously say that caffeine is also not so healthy for our health. to enlighten this problem natural, or to enlighten this problem that we believe some compounds which is natural is good. It's a good alignment. The story of Coca-Cola. Everybody knows Coca-Cola. Maybe somebody tried it, and we are still alive. But we know that Coca-Cola is not the healthiest drink. Coca-Cola was invented by John Pemberton, who was a pharmacist. You know, pharmacists always clever. And he made Coca-Cola, and he released this product, this drink, in the US, Atlanta, in 1886. And do you know what was inside the original recipe in the Coca-Cola? It contains extract from cola nut, which contains caffeine. It also contained, coca leaves, which contains cocaine. So that's why Coca-Cola is Coca-Cola, because coca remind us that it contained in the original recipe cocaine, and also carbonated water, which was other new investment in the 19th century. So before the 19th century, people never drink carbonated water. And there was a type or variation of the recepts, the prescription for this medication, which involved red wine in Coca-Cola. So when you drink this type of drink, which contains caffeine, cocaine, and alcohol, maybe it's an excellent brain tonic. That was the advertisement, that this is an excellent brain tonic. It's very interesting, because at the end of the 19th century and at the beginning of the 20th century, cocaine was the drug, the compound, the natural compound, which believed that it will solve all the problems. It was the aloe vera, for example, in the end of 19th century, or it was the algae in the end of 19th century. And here you can see some advertisement which says that it's, for example, just see this big one, it relieves exhaustion. And this is true, because if you take caffeine and if you take cocaine, you will be refreshed. Your brain will be absolutely brushed up, and it will be new energy in your body. But of course, it's dangerous, because we know that both caffeine and cocaine is addictive. And the funny thing, that first red wine was withdrawn from the Coca-Cola, and only later in 1912 or something like this, cocaine was also withdrawn from the drink. So this is a nice story that when we believe that natural is safe, it can cause some problems. And pharmacology was important to discover that cocaine is not a natural compound to consume, because it's dangerous. Basically, cocaine pharmacology studying the drugs or even natural products in actions in animals and humans. That's the aim of pharmacology, and to clarify what is the effect, what are the consequences of the long use. Okay. Louder. Okay. Oof. Okay. So the aim of the pharmacology to study how the different drugs and how even natural products can act in animals and later in humans. But these studies should be firm base, so the principles always comes from science. And the scientific research, I know that many people have some bad feeling about the science, but science is important, because science gives a quality control, because the scientific study involves at least 4 principles. First, in the independent observation. It's very important, because if I tell you an example, if I have a very strong suggestive power, and I try to convince you that if somebody smell my left shoes inside, and it has a healing power, and you are able to believe that my left shoe smell will heal all your diseases, we will find only few persons will die, but those who survive it, they will feel that, yes, I'm really better. But nothing happened, just we believe in such a strange method. So that's why the independent observation means that when we investigate the efficacy of a drug or a method, we cannot talk to the patient that believe that this is the best one, this is a new one, this came from the US or developed by the NASA, and even the people at the moon ate it. So there are many types of suggestive pursuing that believe that this is very effective. No, if we have to do a scientific study, we have to do independent observation. This in the health experts calls it that this is the double-blind study. Even the patient and even the physician don't know that the compound or the medication what is given is effective or not, and this is very important. The second thing, that all the parameters which describe the disease should be detectable. It's not enough to say that I am better. It's absolutely subjective. So when we talk about even cancer, lymphomas or other diseases, hypertension, we have to be sure that even the cancer status is improved, the blood pressure is decreased, the blood sugar level is decreased, or all the parameters which reflect the condition of the patient is really improved. Very important thing to understand the mechanism of action of the compound. If we don't know what we do, it's very dangerous to use it. And the fourth principle, that all the methods, all the medication, what we do, all the healing process should be reproducible. We have to be able to repeat. It's not only one case. One case, it can be happen, but this is called miracle, even in the Bible. If you remember some healing in the Bible when, for example, Naaman went to the Jordan against the leprosy, it happens only one time. And Jesus said that there were lots of leprosy persons at the time of Naaman, but only Naaman was healed. The Jordan was the medicine only for Naaman, nobody else. But when we talk about medicine, we have to find medicines which can heal the majority of the patients, and we know how it is work. I have a wonderful example from Hungary. In Hungary, there is a very popular food supplement called Bearish Drop. Joseph Bearish was an investor who made these drops maybe 30 or 40 years ago, and 25 years ago when I was first year student at the Faculty of Pharmacy in Szeged, I remember the big crowd who went to the shop, the medical plant shop, to buy Bearish Drop, because everybody believed in Hungary that this drop will cure cancer, any type of cancer. And even in the media, people were shown that this man and this lady was absolutely uncurable condition, but they started to use this Bearish Drop and the cancer absolutely disappeared from their body. Nowadays, 25 years later, nobody goes for Bearish Drop to healed from the cancer, because the Bearish company had enough intelligence to make detailed and expanded research. What is true? What is the truth about the effect of Bearish Drop? And they found that it's not good against cancer, but it can stimulate the immune system. It contains many variable trace elements and minerals, and this is very good for the body. And 25 years later, nobody except to be cured from Bearish Drop, and nobody cured from cancer from Bearish Drop. So it was a little bit long time, but this compound, by pharmacology and scientific investigation, find a place. And this is a very good food supplement, but not a miracle agent. So the next important thing what we have to mention, this is the evidence-based medicine, which means that we are using systemic approach to analyze published research as the basis of clinical decision making. So we have to know the evidences, what we use and how we use the medications. By the way, the medicines, and I want to emphasize it, and remember when you throw away a tablet, the medicines are the products containing the highest knowledge and information. No other products you can find in the market in which you can find lots of knowledge and experiments and information than in the medications. Drug development. It will be maybe surprising for you, but this is a scale or a figure, how long does it take and how many drugs is started, for example, as a potential medicine, and how many reach the registration. And you can see that there are some experimental parts. Maybe if we say that 10,000 compounds are started to be a medicine, at the end of the preclinical part, which means the end of the animal studies, only 250 compounds remains, and this process takes more than 6 years approximately. And after here comes the human trials, and you can see that even human trials, the second phase of the human trials, only 5 compounds will survive and only maybe 1 compound will register. So from 10,000 compounds, only 1 compound will reach the goal, and it takes 6 years and 6 years and 2 years and 2 years, so it's 10-15 years to make a medicine, 10-15 years and lots of examinations. Why it is so long? Because there was a catastrophe, it's called Contagion catastrophe. The compound was thalidomide, which was used in the 1970s, and this compound was given specially for pregnant women to reduce anxiety, to reduce the mood disorders, and they believe that it's a good medicine, but unfortunately this medicine caused a very, very severe birth defects. The defect, the babies was born without legs, extremities, so it was terrible, and even a sculpture was made in a memory of dead and the survival of the thalidomide catastrophe. So this was a step in the history of pharmacology and drug development when it was decided that all the drugs, all the compounds which is suspected or intended to give to human being, it should be examined in a very detailed way. And that is the reason that more and more complicated investigation should be done, and the duration, as I mentioned, is 10-15 years. If we go back for 40 years ago, maybe 3 years was enough to release a new drug, a new medicine. Now it's 15 years, and here is the cost. This is another shocking data that it's 1,000 million, $1 billion US dollar. This is the cost which is necessary to develop a new drug which is taken by us. Very important part of the drug development that we have to be careful to the market value and the saleability. That's why rare disease or those diseases which requires only a short treatment will know new drug, because nobody want to invest for a drug which should be used only 1 to 5 patients or only few months, because the money will not come back. So I always say that if you want to get a disease which is a very wide disease. So don't try with rare disease, because you will die. There is no medication. Sorry to say this, but that's the truth. As you see, 5 molecules reached the final one, and here is just represents the crisis of the new drugs. Even we have a problem in pharmacology because the costs are huge, and there are only few new candidates. So those drugs which are using now, these drugs are the results of the investments of the last 20 years or 30 years, or maybe more. But nobody knows what kind of drugs we will use 20 years later, because no idea. The development, the drug development now is working on altering the drug absorption. So old molecules in new clouds, and it's enhance the absorption, it sustain the residence time in the body, and maybe it can help. But only maybe the cancer therapy is a good field, because these special monoclonal antibodies, targeted therapies in cancer, they have some new possibilities, but generally the number of new drugs released every year is going down. So what are the steps of drug development? First, there is a molecule design and synthesis and preclinical studies, and after the clinical studies, and here also see these lines, how it goes on. Molecule, I don't want to tell everything what is written in the slides, but it's very important to know that nowadays when somebody wants to find a new drug, it's not just a serendipity that do something and try it works or not, but we have to find a target, where to act, and after we have to model it, and this is mainly done by computers. So if we know the target, what we have to attach or affect by the drug, in computer, it is called in silico design, we can modelize that what kind of molecule will be able to bind to that organs or to that cell particles. After, the compound should be synthesized, many variation, this is called molecular libraries. Even recombinant gene technologies can be involved instead of synthesis, because if we put special genes into microorganisms, mainly Escherichia coli, they can produce a lot of things we do not to synthesize in laboratories. Of course, a whole chemical analysis is necessary to filter all the contaminations. And the next step, we have to solve the production of these maybe promising drug in gross. For example, in just a simple toxicity studies, we need kilograms of these products. So it's very nice if somebody prepare a few milligrams of a wonder molecule, but to be a medicine, we have to do in kilograms or in tons, finally. And if it is not possible, it means that that is the end of that promising candidates. Here you can see some figures about the molecule design. It's just for taking a breath. Okay, preclinical studies. These are the men who are working with animals, and I am involved in this study basically because I am working in this preclinical phase, and we are doing experimental studies. Those studies are under strict control, quality control. And first, we have to use animal tissues, and after we have to do some pharmacodynamical studies, choosing maybe cell cultures, tissue cultured, isolated organs. This is called in vitro studies. So we are testing only just animal tissues, how the drug is working. And finally, when everything is okay, we can go for the whole animal studies. Maybe it's not so nice, but you have to know that these animals, not this one, is just a cartoon, but those animals which are used in these experiments, they are breeded for experiment. They are white albino rats, so sometimes some animal freedom fighters try to come to the labs and release the poor animals, but if these laboratory animals are released, they will die because they cannot hide, they cannot do anything because they are white, and all the predators find them quickly. So the best place for these laboratory animals is the laboratory because they are not able to live outside. And of course, let's go forward. Pharmacokinetical studies are also important because we should know how the drugs are trafficking in our body, how it's absorbed, how it's transformed, and how it's excreted from our body. And it's very important. Many times people say that it's not worth it to use animals. We just use cells or tissues or something like this. But a cell and a tissue has no liver, has no gastrointestinal tract, so we must test how the drug behave if a whole organ is contact with the drug. The in vivo studies should have analytical background because we have to check how the drug level are changing in our body, and it's very important to follow up the metabolites because very frequently a drug is eliciting its effect metabolized in the liver, but the metabolite will goes back to the circulation and the metabolite has still effect. It's very popular drugs are the benzodiazepines, so maybe the Seduxan or Elenium, or these drugs are well known. These type of benzodiazepines are very special drugs because they have 1, 2, 3, even 5 metabolites, and all the metabolites are active. So if somebody commits suicide action with a benzodiazepine, it's very difficult to save the life. There is a good antidote, but this antidote should be given every second, third hour for the patient as the new active metabolites are coming again and try to kill the patient. So it's a very important part how many active metabolites are created in the body and how it affects the whole drug effect. The toxicity study is very important. We can do acute toxicity, and the aim of this toxicity study to find the most sensitive organ of the animal and determine the ratio of the effective and toxic doses. Recently, we are searching for the approximate lethal dose, so we have to see that what is the dose which approximately kills the animal. It's not a nice part of the study, but it's important to safety to know that what is the difference between the effective and the toxic or even lethal dose. Yes, it is determined that at least 2 mammal species must be involved. Both sexes must be involved in these animal studies, and at least 2 ways of drug administration should be given, and one of them should be intravenous and the other may be oral or subcutaneous. It depends on the preparation. And the duration of this study only maximum 2 weeks, and after the study, all the animals, both the dead and the survivors animals, should take into autopsy, should take out everything and investigate what is in the liver, what is in the spleen, what is in the heart, what is in the brain, everything. Because maybe the animals survive the study, but we can find some severe damage in their organs. Subacute toxicity takes a longer time. Recommendation or the rule is quite similar to the toxic way, but here we have to use 3 doses, a low and high and an intermediate dose, and here is also an autopsy for all the animals which were involved in this study, and also histological examinations are necessary. So in this case, histological studies and streams should be done to validate the effect of the drug. And after comes a chronic toxicity study. In this case, also we are using repeated doses, but you can see that the duration of such a study is at least half a year with lots of animals. This study also ended by autopsy. All the animals should be investigated. Every organ should be investigated. What was the consequence of the drug action? And this is not the end, because we have to do some mutagenicity study, how the potential molecule cause genetic harms. Even it should be started in bacteria, but after we have to go for mammalian and human cells, in vitro, of course, just using cells, checking the genotoxicity, and finally, when these studies are finished, we have to try it in vivo in living animals, how the genes are altered, harmed by these potential new compounds. Fertility study is also very important because we have to know how the fertility is changed in animals by a new candidate. The females animals should be treated during the pregnancy, and half of the females should be sacrificed before delivery. Even the fetus, the fetuses should be studied what happened with them during the pregnancy, and the rest, the other half of the females, should allow to deliver and the offspring and allow to grow up the offspring, and after these offspring should be mated, making the grandchildren and checking that what is there any consequence in the second generation of these potential compound. So it's a very difficult and very long study, but it's not the end, because there are prenatal studies. It means that we have to investigate the offspring after delivery, during the lactation period, and also we have to allow to grow up some offspring to investigate what happened with them. So this is another story that how, for example, the drug affect the life of the fetus or the offspring during the lactation, because we know that lots of drugs or majority of the compounds are excreted into the mother milks, and it can cause several problems. For example, nicotine, which is a natural one. Don't forget that those mothers who are smoking during pregnancy and lactation mainly, they can cause a very severe harm, because the nicotine concentration in the mother milk is triple as compared with the blood concentration of the mother. So the baby who are fed by a smoking mother get a triple concentration from nicotine than it is in the mother milk or mother blood. So it could be very important to know what happens with the drug if it is excreted into the mother milk. Teratology studies, because the teratogenic effect, which basically the thalidomide story was about this teratology problem. In the third trimester of pregnancy, there is an organogenesis, and if something happens during the organogenesis, it means that it will be very severe problems. And to avoid such a problem, like the thalidomide catastrophe, basically all embryonic stage should be investigated, how the drug affect the embryonic stage, and the protocol is that at least 12, maximum 20 pregnant female animals should be used, and they should be mated, and after the mating they should be treated by the drug, and after the fetus should be removed before delivery, and just checking what happens with the fetuses. And also in mothers we should do some examinations. Maybe some implantated fetus are resolved because of the drug, and so on. And even the fetuses should be checked, calculating their numbers, sex, weight, and abnormalities, and even autopsy should be given or should be done with the fetuses. So it's a very difficult and very heuristic work. And when we finish this part, we are going to the clinical part, which is also long and takes much more money than the preclinical studies. You can see how the dollars are increasing. So the phase one is not so expensive. It's expensive, but not too much. But as we go further and further, it's consumed more money. These type of clinical studies are controlled by the good clinical practice, so there is also a quality control on it. And we have to say that these clinical studies have a risk, a life-threatening risk, so there is a 0.05% for life-threatening side effects during these studies. In the first phase, mainly or only voluntary persons are involved, and they earn money. So there are some people who have the occupation that they are clinical study volunteers, and they are traveling all around Europe. Of course, to be clinical study volunteers, maybe you need some madness, because it's it's risky a little bit, but sometimes people choose this job. Very important that there is a very strict quality control during the study. Many permission is necessary. Facilities should be approved for reanimation because anything could happen. And those data which are made by these clinical studies, but also for the preclinical studies, should be archived for 15 years. So we have in my department, our department, we did some preclinical studies, and we have a room, and we put all the documentation there, and we can throw it away maybe 10 years later because maybe 5 years left. So this documentation is very important. This is also safety, because if a drug is registered and after registration something happened, everybody can go back to the notes, what happened during the clinical studies, preclinical studies, and we can check that was there any sign of this type of problems, or it's just something new which cannot be filtered earlier. So it's very important that you can go back to the history of a drug, what happens during the development. Yeah, so this is just a pictogram how to go through a clinical study, but I think it's not so important for us now. And let's see briefly the phases. The phase 1 trial has the aim to determine the well-tolerated dose of the drug and get some pharmacokinetic information. Of course, for example, it cannot be used in the case of anti-tumor drugs because the classical anti-tumor drugs had lots of side effects, so it's not worth it to make a risk for the side effect. But the majority of the drugs can be involved in the phase 1 trials. This is the double-blind study. It means placebo control. You know, placebo means you will like me, or you will love me, or something like this. So placebo means that it calculates that if you believe in a drug, you will be better. And we have to compare that this belief, which everybody can believe that the drug is effective. So, but if somebody get nothing, and it's getting better, it means that it's not the effect of the drug. It's very interesting, especially in anti-pain tablets or drugs or analgesic studies. We found that maybe the 30%, sometimes the 40% of the patients who get nothing, just the placebo, will respond that his or her pain is much better now. You know, the pain it cannot be detected. We have no tools or equipment to measure what is the level of pain in our body. It's absolutely individual, and only the patient can compare that the pain before the tablet and the pain after the tablet, what is the relation between the two conditions. But of course, so that's the placebo. So psychical condition is very interesting to influence the drug effect. But of course, if somebody has a pain and we always give them only placebo, it can maintain maybe a few days, but no more. There is another way of placebo, or the opposite thing. This is the nocebo, when we decide that the drug will be harmful for us. You know, when you take a medicine and read the leaflet and the side effects, and even you don't swallow the tablet, maybe it's in your throat, but you start to feel the side effects. This is the nocebo. The drug even not saw, it was not possibility for the drug to elicit any effect, but you decided earlier that this drug will be harmful for me, and you will feel the side effects. It's very interesting. So these double-blind studies to filter out this mistake from the drug effect, and we have to show what is the real effect of a drug. There are two subtypes. It doesn't matter. And what is important or interesting that, as I mentioned in first phase trial, they are volunteers, and only men can be involved, healthy men, and they have to be between the age of 18 and 50. And they have to be free. So from the prison, we cannot involve persons because they are not free to do it, or soldiers, or these. So it's cannot do only free will allows, and this age allows, and if you are a man, this allows to participate such a study. Sometimes some pictograms are made for these volunteers, what to anticipate. So even it's like a holiday, go in, you get a dinner, just talking, free time, bedtime, and so on. And after comes the black part that you have to wake up, condition check, and you get the drug, of course, regular check, and so on. And finally, these volunteers are discharged from the hospital, but they have to go back 1 week later for a follow-up checking. So basically, there is a quite good steps what happens if you are a volunteer such a study. Of course, continuous medical control is necessary, and they try to determine the initial dose from the animal studies. Maybe they are using 1/3 or 1/6 of the minimal effective dose from animal studies, so they are starting with a very low dose, or they are using the 1/600th part of the approximate lethal dose. So a very low dose is given for the first human trial. This is because the animals are more resistant against the drugs, so the humans are usually more sensitive to the drugs than the laboratory animals. The study should be interrupted if the patient or the volunteer dies. It's rarely, but it could happen. Or if there is any severe side effect, even after a break period, a placebo period, or the parameters what we are investigating are changed more than 25%. So if the liver enzyme levels are increased more than 25%, or the blood pressure is increased by 25% or more, the study should be stopped because it could be risky. In the second phase, there are no volunteers, but there are selected patients, because these second phase, only those patients can participate who have only one illness, which is the illness what for the drug is developed. And it's very difficult to collect these patients. And here they can be older than 50 years old. When the trial is finished, the patient should be treated furtherly with normal therapy or traditional therapy. So it's just a period from the life to be treated with the new drug. In the first phase 3 trials, this is the huge one, because this is a so-called multi-center trial. It means that many hospitals, many clinics are involved in this study all around the world. Many patients are involved, and in this case, patients can have several diseases, not the only disease what the drug is designed. And this phase allows to compare the efficacy of a new drug compared to the older ones. And if it is successful, this means that these drugs can go for registration. But it's a tragedy for the investors when some drugs are failing in this phase, because it means that they put half a billion, at least $500 million for a drug. And if they have to say that, okay, it's not good for human, it's a huge, huge problem for a company, and even for the persons who invested the money for the trials. And finally, we have a new medicine. So we ran all these 12, 15 years within a few minutes. It seems to be easy, but it's very, very difficult. Why drugs or medicine is good? What we knew, or what we know by the new drugs. We know the indication. When we have a new drug, we know that what for is good. It's not like folk medicine that for a treatment is told that to cure 13, 15 diseases. It's maybe cure one disease, but we know that this is the disease which can respond well for the therapy. We know the mechanism of action, how the drug is act, what is the site of action, how we should use it. We have a dose, and it's very important, because if you make drugs at home, or if you make even herbal therapy at home from toxic plants, you cannot guarantee the dose. So the medicine have a dose, and you can trust that this dose is safe if you follow, of course, the prescription. So if it's told that if your compliance is good, if you have bad compliance, maybe you can make a toxic effect or even no effect because you doesn't follow the prescription. We know the pharmacokinetics, we know the most frequent side effects, and we know the toxicity data. So this gives the safety. And this is why new or a drug, a medicine, is one of the most worthy product in the world. But I have to tell you that the trials is not ended, because it is a so-called phase 4 phase or study. When the medicine is already used, you can take it from the pharmacy or prescribed by the doctor. A continuous follow-up is taken about the side effects, interaction, the new therapeutic applications, and all the health experts has a compulsory report. If somebody experience a new side effect or a new interaction which is not involved in the leaflet, it should be reported. And if it is true, these side effects should be involved into the leaflet. That's why you can see lots of thousands, not thousands, but many side effects in a leaflet of a medicine, because even only one person had a side effect. Those side effects in the world, it should be written. It will be written that this side effect is very rare. So if you read a leaflet, you always have to focus on the very frequent side effects. The very rare side effects means that you have maybe higher chance to win the lottery, but of course the Adventists never play lottery. But basically, if the side effect is very rare, it means that there is no chance to get it. But if it's very frequent, maybe you have 8–10% risk to feel or experience the side effect. So that's the story of the drug development.